questions pretty quickly. So this is always tricky. Let me do this. I'm going to, the easiest way to do this is if I just call on people as I see you on the screen. So I will start with Megan. You're at the top of the list, so why don't you go ahead?
All right. Hi, everyone. Good afternoon. Megan McDavie. I am a program officer with the Peter and Elizabeth Tower Foundation. I live and work in the Buffalo area and was part of cohort 6. Something I'm hoping to get out of today. I'm so happy to see new faces and just hoping to welcome you all aboard.
And I'm actually next, and I suppose I should have introduced myself. Hi, I'm John Craig. I'm the Executive Director of the Population Health Collaborative here in Buffalo in Western New York. I was part of cohort 4, and since I'm doing a little speaking today, what I'm hoping to get out of this is not saying anything too silly. Marnie, you're next on the list.
Thank you, John. I'm Marnie Anisi. I'm a program officer with the Health Foundation for Western and Central New York. My office is in Syracuse, but I work across both of our regions. I'm a member of cohort 9, so recently, well, not even quite graduated yet, I guess, technically. And one thing I am hoping to get out of today is to get a better sense of the work of the steering committee and to meet some of the new members and the new volunteers.
Thank you. And I just noticed we're recording, so I just think it's good to tell people that, just so you don't say anything. Pei, right? I think Pei, you're next on the list.
Hi, yes, I'm Pei Grant. I'm the research director at Hospice and Palliative Care Buffalo. We're situated in Cheektowaga. I'm also from cohort 6 with Megan. And today what I'm hoping to get out of is I'm really excited for this reboot of the FAN. And so I'm eager to learn about the new vision and being part of all that.
Thank you. Kexen Ma.
Hi, I'm Kexen from the Homeless Alliance of Western New York. So we're located in Buffalo, but we service 5 counties within Western New York. I'm the director of federal program here. What I'm hoping to get out of just meet new people and learn about what other community do.
Great. Alice.
Hello. Oh, don't take that list off. I won't know what to say.
I'm sorry, it was a typo.
Hi, I'm Alice Suffolk. I am the consultant to the FAN support with Population Health Collaborative. And I focus on Central New York, getting more participants from the membership or participation from the membership to be involved with FAN. I was part of cohort 4. And what I'm hoping to get out of today is I'm excited to see everybody on this meeting, and that that we hopefully get some excitement rallied here for moving forward with the FAN.
Thanks. Max, you're next on my screen.
I'll unmute. Hi, everybody. Max Donatelli, and I'm a family advocate and I'm a parent of a child with a young man with developmental disabilities, and I've been involved in doing advocacy work for a number of years and continue to do so. Involved in a number of organizations that support them, as well as also involved with the Anti-Stigma Coalition, and also involved with the Diversity, Equity, Inclusion, and Justice Committee, which we'll talk about a little bit later. I'm from Hamburg in the Western region, was part of cohort 2. And what I'm hoping to do is to really help to generate some excitement, similar to what Alice said about really engaging more members and really strengthening the FAN to have a greater impact on Western and Central New York.
Thanks. And if there's anyone here who doesn't need an introduction, it's the next person on my screen, Sharon. Matthew.
Thanks, John. I'm Sharon Matthew, cohort 1. So I've been around since 2005. Semi-retired, and I'm working from my home, as you can see from the background, just like many of you folks today. I live in Ellicottville, so Cattaraugus County on the southern tier. And one thing that I'm hoping to get out of today is to share some of the history of FAN and the enthusiasm and my belief in the power of the FAN.
Terrific. Thank you, Sharon. Pam Keffy.
Hi everyone. I'm Pam Keffy. I am the Executive Director at Deaf Access Services, but we're merging with People Inc. So I have a new title over there. I'm an AVP, Associate Vice President, and getting involved in a lot of the different initiatives at People Inc. It's kind of hard to describe my position right now. I'm from Western New York, cohort 8. And I'm looking forward to learning more about the history of the FAN and expectations for me as a member of the steering committee.
Thank you. Brett, you're up.
Hi, everyone. Brett Lawton. I am from Buffalo, live in North Buffalo, work on the east side of Buffalo. And I work for SNAPCAP Inc., or the Safety Net Association of Primary Care Affiliated Providers, and I'm the executive director there. And I was a part of cohort 4. And one thing I'm hoping to get out of today is to meet you all and to catch a new vision for the work of the steering committee on the FAN, and to just see what we can do together. I'm excited about that.
Thanks, Brett. Jeffrey Jackson, you're up next.
Hello, everyone. Jeff Jackson. I am faculty in the English department at SUNY Cortland. I live in Syracuse. I was part of cohort 5. And like pretty much everyone else here, I am looking forward to meeting those of you that I don't know and seeing how we can be of help.
Terrific. Thank you. Marnie.
You really want me to go again?
Did you go? Oh, it gets out of order. Sorry. All right. I'm sorry. I'm confused. All right. Thanks.
Can I nominate somebody?
How about Monica?
Hi, everybody. My name is Monica Richardson. I am from Western New York, but I currently live and work in Central New York, and I'm with Onondaga County Health Department, and I'm the Healthy Start Program Coordinator. I am looking forward to learning more about the FAN, the roles, and the expectations. And I'll jump out there and say one fun thing that I did during COVID is my 7-year-old and I went zip lining at Greek Peak.
Oh, cool. All right. The title says Parkway Center, but that's Cassandra, right?
No, Kelly Walters.
Oh, Kelly. I'm sorry. Oh, shoot. Sorry. Yep. All right. I screwed up.
Sorry, I don't know why it didn't come up my name.
That's all right.
That's okay. Kelly Walters, I work at the Parkway Center. I'm the executive director. I live in Utica, so Central New York, and I'm part of cohort 5. And I have been involved in the steering committee for a number of years. So this is re-engaging and looking forward to it growing and getting more expertise and excitement involved.
Thanks. And thanks for being gracious when I got your name wrong. Elizabeth Crockett.
Hi, yes. So I'm more widely known as Liz. I mean, I love my name Elizabeth, but you can call me Liz if you remember to. So I work at Reach CNY. I'm executive director. It's a not-for-profit in Syracuse, so Central New York. We work on public health, maternal child health, and in particular, and teen pregnancy prevention, and a lot of great stuff like that. I was part of cohort 4, and I'm excited to be roped into this by Alice, which is a good thing. And so I am looking forward to really just learning more about what to do. And I know that this is going to benefit me a lot. So thank you for the ability to be involved.
Thanks.
If that was roping, that was some easy roping.
I told Alice, like, if you wanted something like the old shy white woman like involvement, I could do that.
And it's hard to say no to Alice. All right, Karen,
She's wonderful.
Karen Hall, you're next. You get your mute on. Your mute's on. There you go.
Sorry. Okay. Good afternoon, everybody. I'm Karen Hall. I work with the Population Health Collaborative. I'm the program director there. In this role, I'm the network manager for FAN. I am from Buffalo, live and work in Buffalo, Western New York, cohort 7. And one of the things I want to get out of today is to just get to know everybody a little bit better, hopefully create some excitement about joining some of the subcommittees and give everybody some more information about what the expectations are.
Thank you. Michelle Latham.
Hi, everybody. I am Michelle Latham, as John said, and I serve as the Chief Operating Officer with Catholic Charities of Buffalo, and that is in Western New York. I too, along with Karen, was cohort 7. And one thing I'm hopeful to get out of today is just to get myself back to what I committed to, being more active with FAN after I graduated from the Fellows Program and have not done such quite a good job. So I'm committing myself.
Thank you. Marnie, you're popping up again, but I've learned my lesson. Donna Kane.
Sorry, it took me a minute to unmute. Donna Kane, and John says my last name right, so I'm so proud of you.
That's fun.
I work for Southern Tier Healthcare System. We're a rural health network that covers Cattaraugus, Chautauqua, and Allegheny County. I was part of cohort 5, so it was great to see Jeff and Kelly up there, and I think Liz is on too. We were a very close cohort, so I'm excited to be able to work with them again. And again, I'm looking forward to meeting new people and finding new collaborations that we can do with others that are part of the FAN.
Thank you. All right, next on my list is Liz Woke-Ganga.
Hi, close enough, and I'm also Liz, which I have there. I am the president and CEO of Best Self Behavioral Health, which has been the most interesting thing that's happened to me during COVID, is getting promoted to CEO in the middle of a pandemic, so that's been fun. I'm here in Buffalo. I was in cohort 5, and I'm also looking forward to just getting re-involved with the FAN and just being a part of what's going on.
Why don't you pronounce your last name, just so we might as well know it.
Woke-Ganga.
Woike, okay, I was close. All right.
Close, you were very close.
And this next person, so this isn't my fault because I can't see the whole name, but it's Michael Prutz something. Sorry.
I've been called worse. This is Michael Prutzman. I'm the executive director of the Council on Addiction Recovery Services in Olean, New York, Cattaraugus County.
Oh.
And I am obviously Western New York, part of cohort 9. And what I'm hoping to get out of today is getting to know more about this steering committee and the FAN, as well as always happy to get to know people and collaborate more all the time. So I appreciate the opportunity. Really looking forward to it.
Thank you. And the next person on my screen is Dr. Brandis P.E. something. So take it away.
Hi.
Pearson. There you go.
Yes, Pearson. So the questions are, I am Brandis Pearson. I am the Director of Community Engagement for St. Joseph's Health in Syracuse, and I live in Syracuse. I'm so glad Pam said we were cohort 8. because I was like, I don't remember. Cohort 8, and I am hoping to just continue the collaboration that started with the fellows program. And one exciting thing, I'm still a neophyte in this doctor thing. So I successfully defended my dissertation August 28th. So I am Dr. Brandis until I'm tired of hearing it.
Congratulations. That's very exciting.
Thank you.
Tara Maving.
Good afternoon. I almost said good morning.
Yeah, me too, right?
Everyone. I am Tara Maving. I am the Director of Outreach with the Population Health Collaborative. So I work alongside with John and Karen. I live and work in Buffalo, in the Buffalo area. I'm actually hopeful, I'm hoping to be in cohort 10. So I'm hoping to have that happen. And I think one of the biggest things, it's interesting, I see a lot of your names weekly as I send out the newsletters and do social media and some back end work, but it's nice to see, put some names to faces, and I'm hoping to engage with more members through this orientation today.
It's Tara. And last on my list, I think, hopefully we've got everybody's, Randy Hoke.
Hi, everybody. Yes, as John said, I'm Randy Hoke. I work for AARP New York. I live in Hamburg, New York, just south of Buffalo. My work is primarily focused in Western and Central New York, and I was a part of Cohort 5. I've had the pleasure of checking out some fan events, helping out on some fan events over the years. So it's nice to be back. It's nice to see so many faces here, so many familiar faces. And I am very excited to hear about what's next for the fan.
And as I look at the screen, I think we've got everybody. And did we miss anyone? I don't think we did. Thanks, Pam. I see Pam nodding. All right, so yeah, there's the agenda, and it's a pretty lengthy agenda, but we've got a lot of different people talking, which I think will kind of make it move a little bit more quickly. We actually have a nitty gritty now, which is kind of fun. Again, we're always trying to strike that balance between being, organized and structured, but also open and kind of free flowing. So again, it's always a balance. So when in doubt, say something. I think that's kind of the bottom line. So. We're just going to going over some of how we're operating now, how we kind of really hope to operate as we get going over the course of the next couple of years, and then Sharon in particular is going to give us kind of a sense of the history and the perspective and kind of where we've come from, and that will be very, very interesting, and it will kind of set the table for where we're going. So again, I think that will be fun, and then Tara's going to talk about a new platform we have. We're just in the kind of late stages of implementing, getting ready to fully kick off an online platform that hopefully will facilitate a lot of communication, a lot of collaboration, a lot of other good things. So I think that's it. We'll talk, next steps, and then when we do the Q&A, Megan, at some point I think it'd be fun to, take down the slides and then kind of see everybody's faces too. So we can probably do that toward the end and just say goodbye to everybody and congratulate Dr. Pearson again. So who's up next? It's not me.
I'm going to hand it off to Marnie.
To Marnie. Okay, great.
I knew you were going to say that, and then I couldn't find the way to get myself unmuted. So, so welcome everybody. Thank you for being here. Nora O'Brien-Surek, the Health Foundation president, was unable to be here today to welcome all of you and to show her appreciation for everything that you do through the fan. So she asked me to step in, and I am in no way an equal to her in terms of her knowledge and passion about all things related to health, but I'll do my best. So thanks again for being here. The Health Leadership Fellows Program is one of the Health Foundation's earliest and longest running programs, and hundreds of nonprofit professionals have been trained on leadership, communication, results-based accountability, and collaboration. As I mentioned earlier, I'm a member of Cohort 9, and actually today was the day that our final projects were due. So you can see that because of COVID, the scheduling was all off. And in the end, it wasn't the experience that we had all hoped for, because certainly none of us had hoped for a pandemic. We were unable to complete the program like cohorts before us, you know, staying at a nice hotel, sharing an incredible meal with everybody, standing in front of our peers and judges, the panel of judges. You know, we had to respond to some questions, submit our responses with a final paper. And for me, the toughest question that we were asked to respond to was, what did you learn during your participation in the Health Leadership Fellows program that helped you manage or respond to COVID-19? I was at a loss. I was still in the Fellows program, so I hadn't really stopped to think about what I had learned or how I would use that information. But I think regardless of whether or not there's a pandemic, a lot of people probably don't really stop to think about what they learned during their Fellows experience. I think most of us are just so happy to be done with the program, and I do mean that in the nicest way. But, you know, we go to graduation one day and then we go back to work the next without really stopping to think about how we might do things differently now, or how we might have changed as a result of the Fellows program. When I first started working for the Health Foundation a few years ago, a friend approached me at an event and told me that he had gone through the Fellows program. And so I asked him what he thought about it. And it really struck me. And so this is almost verbatim what he said. He said, I didn't think much about it while I was going through it. I guess I thought it was okay. But now I can see how I'm using the skills I learned in my job all the time. And I think it was really a lot better than I realized. So for me, this is one of the reasons why the FAN is so important. It gives those graduates that already feel connected a place to continue the work they started in the Fellows program, but it's also there when the rest of us finally recognize the opportunities that can come from spending time with a group of people with training and experience in leadership, communication, and collaboration, and a common language. For some, the FAN provides an opportunity to reconnect with their cohort members and meet members of other cohorts, and maybe even have a little fun. Right, John? But the FAN is much more than that. It's a collection of collaborative leaders with skills, expertise, and passion to not only continue the work that was begun in their teams during the Fellows program, but also to take on some of the most pressing health and healthcare needs of our time. So prior to March of this year, we were already facing significant individual, organizational, and systemic challenges that impact the health and healthcare of the people of Western and Central New York. In the midst of a global pandemic, the challenges we face now and in the near future will require the FAN to be more active and more committed to collaborative leadership than ever before. Over the past year or so, the Health Foundation has worked in partnership with FAN leadership on strategic planning because we know the FAN is where the work gets done. We value the time and effort of all the former steering committee members that was put into keeping the FAN relevant, accessible, and a valued asset for our communities. And we welcome with great appreciation the new steering committee members and the subcommittee volunteers that will continue to keep fellows networking and working through a most meaningful alumni experience. Thank you.
Thank you, Marnie. Appreciate it. I think that I'm even more grateful for all the Cohort 9 representation on this call, hearing that context for your experience too. So, well, welcome again, everyone. I'm Megan McDavie, and I have been involved as a steering committee member of the FAN for probably about going on 4 years now. And we have been in a place of really reorienting ourselves to the work, redesigning what the FAN looks like for quite a few years. And I think we are all so excited to welcome in a fresh group of volunteers that can really be a part of the action, moving us into the action phase of this work too. So in front of you right now, you see our mission and vision statement, which were generated by a strategic direction subcommittee of the FAN. And just so everyone is aware also, I think it's important to note that we have on this call today people who have volunteered for the steering committee from both Western and Central New York, as well as subcommittee members who are volunteering to help us get the programming done on the ground. And so I wanted to make sure that everyone knows that this group is multifaceted and reflects different volunteer positions within the FAN as well. And we need all of you, and we're so grateful to have you. So I won't read to you our mission and vision, but just underscore the fact that we had a group that worked really hard to pull this together, and we feel pretty proud of where we landed. That being said, when it relates to our strategic plan, we had a 2-year strategic plan that the FAN Steering Committee approved last September, and it focuses on 5 key areas. And this strategic plan is really meant to be a breathing, living tool that informs our direction, but in no way limits us. So all of you here today, if you see things or have questions on components of the strategic plan, that is absolutely 100% your purview to be asking those questions and to help us guide the work. After this call, in a couple days, I'll send the recording, the PowerPoint, and also a copy of this to the full strategic plan, which has been sent out in the past by email, but we'll send it again so that you have it in front of you. So, as I said, there's 5 key areas in the strategic plan: infrastructure, communications, network, advocacy, and demonstrated value. And so from an infrastructure perspective, this is truly where we've spent a ton of our time in the last year working. This is all about strengthening the FAN's network's capacity internally to deliver high quality programming to our FAN members. So we worked really hard to reestablish our FAN subcommittees, to build up our FAN steering committee. We've worked hard to support that shift in network facilitation over to Population Health Collaborative, and we feel really fortunate to have the time and talent of Sharon and all of the many consultants that supported this work under her leadership in the past, and shifting those responsibilities now over to Population Health Collaborative and adapting to the new flavor that John and Karen and Tara bring to this work too. So, and from a communication standpoint, we really think, and Sharon will talk a little bit about this when she talks about networks, but communication is critical to a strong and healthy network. If we want to work as a group of leaders that can, rally together around common issues, we have to have strong communications platforms to support that work. Network. So this is a little bit more to that network, the communications piece too. What does it look like to support collaboration after you get out of the fellows program? What does it look like to bring together, to elevate, and to bring new people to the table with collaborative work? This is where we think the magic of the FAN really can happen. And this is personally why I am here at the table and have been for a number of years working to strengthen the FAN. It's because I don't think we have a lot that looks just like this. The opportunity to come together as leaders and strengthen our work to change this community that we live in for the better. Advocacy. This is an important one, I think, just from a history perspective to share a little bit about. So advocacy work of the FAN has ebbed and flowed over the years. And this is an area that I could see really taking off and doing great things, or being a little quiet and underdeveloped, depending on who at the table wants to raise their hand to support this work. So, our intent when we designed this piece of the strategic plan was really to help lift up some of the Health Foundation's advocacy priorities, and to also think about the other priorities, advocacy priorities that other organizations in our communities are working towards right now. And this is an area that we don't have strong volunteer leadership at the moment, but I think that we see a great deal of opportunity. And then the last piece of the strategic plan that I'd point out is demonstrated value, which is really just talking about what do we need to do to both document and communicate our effectiveness as a network. in order to both rally people for the cause and continue our funding through the Health Foundation, which is a really important part of the FAN as well. Obviously, a lot of us are volunteers, but there's a number of consultants that are working behind the scenes to make this work. And the Health Foundation is a critical partner in this, not only in, of course, bringing us all together with the common language and the background of having gone through the Fellows Program, but also in supporting the FAN financially. So this is an important area for us as well, and one that we continue to work on and improve on with the help of others. So with that, I'm going to hand it over to Karen to talk a little bit more about Population Health Collaborative and the role there.
Okay, sorry, had to take myself off of mute. Hello, everybody. It is wonderful to see everybody. And for those of you who I don't know, it's really great to put some names and faces together. So thanks for taking the time to be on the call today. And I would like to give a real big shout out to Megan for putting together for spearheading this orientation right now. I mean, she had a lot of help from other members, but really it was Megan who put all of this together. So big kudos to you. This is fantastic and great job. And we really appreciate everything that you've done in the past, currently, and then will continue to do in the future. So as stated in the beginning, Population Health Collaborative, this is something new for the Health Foundation. The Health Foundation has contracted with the Health Foundation to be what's called a network manager. So what that means is the role of Population Health Collaborative, we manage the FAN budget. We are a liaison between the FAN and the Health Foundation. We manage a lot of the logistics of any of the FAN efforts that come about, and we manage all of the communications. And by communications, Tara's going to go into that a little bit later, but it's the newsletters, it's the social media communications, and a wonderful little tool called Higher Logic that you're going to learn about later. So the other piece that I was supposed to talk about right now is the charter. And I'm only going to talk about just a couple of things that are on that, because for those of you who are steering committee members, new steering committee members, you will see this next Wednesday. Our first official steering committee member or a steering committee meeting will be Wednesday. I believe that's October 7th. So you will see this and everyone will get a chance to vote on it and make it real. But a couple of the things that are on the charter, it talks about the role of the steering committee and what each individual's role is, as well as a whole, a steering committee as a whole. And then the FAN composition itself, where we really made sure when we were recruiting for steering committee members that we had a good mix of Western and Central New York folks. We wanted to make sure that we were diverse in our population with male, female, race. And so I think the committee that worked on recruiting new steering committee members, we did a really, really nice job of that. We have a wonderful mix of geographies here, so it's really fantastic. The terms of the steering committee members, you agreed to a 3-year term with the possibility of an additional term. So for the folks who have been steering committee members for a while now, like John and Megan, I believe that they had the option of really choosing how long they wanted to continue their work with us. So fortunately, nobody said, I'm done. They continue to stay on, and we are grateful for that, because the history is a big piece of what FAN is all about. So when it comes to subcommittees, right now we have 2 active subcommittees, and the active subcommittees are 3 subcommittees, Communications Committee, a Program Committee, and the DEIJ Committee. And it is expected that every steering committee member joins a subcommittee. The subcommittees are led by a lead, and I use the term lead because we don't have chairs when it comes to anything FAN related. For example, I am not the chairperson of the steering committee. I forgot to mention this of what the role of PHC is, but what the role of PHC is not, we are not the chairs of any of the committees, and we are not any kind of decision maker. You all, as committee members, are the decision makers. There is, for these subcommittees, there has to be some sort of a lead in place to set agendas, to invite folks to the meetings, to hopefully lead discussion on committing to a certain date and time every month or every other month, depending on how long you want to meet, to set up the Zoom links, to do all of that logistical type of stuff. So it's imperative that we have a lead that is able to do all of those things. Like I said, there's the DEIJ committee, the program committee, communications committee, and there would be some ad hoc committees that could get added on. They might be permanent, they might be just temporary, just depends on what that is. I'm trying to think of, sorry, I felt the sneeze coming on and it's gone. Okay, sorry. I'm trying to think of some of the things that I'm missing. It's been an interesting journey for Population Health Collaborative. We had some very big shoes to fill from Sharon, and she's been wonderful helping us make this transition. And Alice Seffick has been an absolutely wonderful, wonderful gem to work with, and her role, I'm going to ask her to talk about her role with being the consultant working for CNY, but she's been amazing to work with. Since we're all here in Western New York, we don't know all the movers and shakers of FAN in Central, so she's been great with that. If anybody ever has any questions about anything FAN related, please reach out to me. I think everybody has my email at this point. Happy to talk to anybody and happy to answer any questions or help in any way I can. So Alice, I don't know if you wanted to talk a little bit about your role.
Well, just so far, it's mainly been working with the steering committee to help to recruit for steering committee and other committees. So that's, and then I'm always that, again, in people's ears that don't forget about Central New York. We've had a very strong showing from Western New York through committees and the steering committee, and so the Central New Yorkers need to be there and remind the Western members that we're here and we're not going away. So. Other than that, you know, it is kind of searching out members in Central New York, what their interests are in regards to programming, and getting them to serve on the subcommittees. So that's about it so far.
One more quick thing that I wanted to add is any subcommittee member who is not on the steering committee, you are always welcome to attend the steering committee meetings. And that's also open to any FAN member who wants to attend the steering committee meetings. We've always been very transparent. It's something that we're going to keep doing. So please, anytime you want to join, they're always the first Wednesday of the month at 9 o'clock, 10 o'clock, 9 o'clock. I should know this.
10 o'clock, yep, 10 o'clock.
Thank you, 10 o'clock. So I think that's it. Thank you.
All right, we're gonna hand it off to Sharon now.
Thanks, Megan. Good job, Karen and Alice. It was nice to hear all the details. So way back when, in 2005, 2006, 2007, when Cohort 1 graduated, we were as enamored with the program as I hear many of you folks speaking to. We didn't want it to end. So with Ginny Oler at the lead, we convinced the foundation that we needed to form an alumni association. And we were directed towards the gurus of networking nationally. And Deborah Meehan, if the name is not familiar, she's one of the evaluators of the Health Leadership Program. She works and developed a leadership learning community. And June Holly was one of her partners in that. June Holly is the author of the Network Weaver Handbook that we've used in building this network. And I encourage anyone who's not familiar with her work to go to networkweaver.com and sign up. She has a weekly newsletter and she has lots of resources online that you can download for free. And she is just a hoot to get to know and to work with. So June Holley, Holley. So based on that information, what we did is try to build an organization that is not an organization. There is no structure to it. It is all about relationships. And you can hear that as people speak on this Zoom meeting. They talk about the relationships they built in their leadership program. And why is that? Why is it that we're focusing on relationships? It's to build trust. It's to bring in ideas and innovation. We know that if people work together consistently and have the same sort of basic values and mindset, it's difficult to encourage innovation. Innovation comes from the periphery, from folks who are introduced with different diverse experiences and thought processes. So that's why we've gravitated to the network concept. You can see on the screen, and Megan, you can go to the next slide, please, that there are a number of factors here. Relationships, self-organization, learning by doing, openness and transparency, and sharing the power. If you look at these delivery strategies, in every area you're going to find FAN utilizing these opportunities and these objectives. For example, under building the relationships, retreats. That's the professional development. And up until 2019, we did an annual retreat where everyone from every cohort could gather. We should also mention at some point that not everyone has gone through the health leadership program. We included the Ladders to Leaders, and they were a Robert Wood Johnson program that was sort of parallel to what we were doing in cohort 1. So the foundation welcomed them to participate as well. Therefore, we needed to have a mechanism that introduced people that had not gone through the leadership program to what we were doing under our experience. And that's where we run into the concept we used with the former steering committee that we had co-leads. So there was one from Western New York and one from Central New York to help build that trusting relationship for people to become familiar with each other. For folks that were part of Ladders to Leaders and really didn't know anyone else in Western New York and some of their colleagues in Central New York to learn to work together. Participant-run learning, and we should make that fun, John, because John has really added a new dimension with his little breakfasts and your coffee hours and whatever, because it has to be fun in order to do it. The foundation has supported us through the Action Fund, Innovation Fund. Call to Action was that first real experiment with funding FAN members in order to collaborate and work together. Openness, you've already heard that folks are invited to participate in any of the meetings. We're posting minutes and activities on the website, and I will tell you that that transparency and the ability to build the open sessions and small group gatherings through the website has been a dream since Nancy Blazek's day. She was the second person, and her organization at the time, the American Red Cross, led the FAN for many years. Karen Nelson was the first under Planned Parenthood. So it's been a real journey and a transition over time, but that has been our dream since way back when, that website, and thank you to Population Health because we're getting there, you could go on there and see what other people are interested in, what they're doing, how could you join them and participate in their conversations. Next, please, Megan. So we're distinct from a traditional organization. And just as you learned in the leadership program, everyone is a leader. Support self-organization, that is where we are really working on the website or bringing small groups of people together to work on the side. And that also comes through the financial support of the foundation. Please include others in your conversations. It doesn't all have to happen at the steering committee level or the committee level. Talk to the folks that you know in your community. What are their ideas? Encourage them to bring them forward. If they don't want to do it personally, do it through a committee or the steering committee so that we can broaden our aspects. Next one, Megan. We've already gone over some of this and truly appreciate the work that Population Health Collaborative is doing to carry on our dream. That not only of the more recent steering committee, but all the way back to cohort 1. And again, you can check out June Holly's information because she has done a lot of work about what network weaver is or other roles in a network. And you may find that your place is not a weaver, it may be in another area. One thing that is common to networks, especially on the national scene, is that we are not necessarily built of alumni associations. In fact, we're the rare bird in the room. Many of the networks on the national level are built around equity or they're built around food security. And the idea is that people come together, whether it be in their small community in Michigan or across the nation, to address an issue. And equity is taken front and center in the leadership learning community. Okay, Megan. And if you have questions, put them in the chat for me. I'll stay on after my presentation so I can answer any of those questions. But part of what influenced and reinforced our work from 2016 through 2018 was the membership survey. And many of you on this call participated. It was done at the end of 2018. We were able to get the data collated in 2019. And I want to just hit some brief points of that membership survey. So asking the question, in your opinion, what is FAN's mission? And you can see the 3 themes that we keep talking about: connecting, communicating, collaborating. The newsletter, the weekly newsletter, electronic version, came through because of that communication need. The work that you're going to hear from Tara is also reinforcing that communication and collaboration. Go ahead, Megan. So in your opinion, what role should FLAN play in the local communities? You can see the answers here, but I want to emphasize that the foundation is really looking to partner with FAN. For many years, they supported us and allowed us to develop without any expectations or return on investment. They look to us to be ambassadors, to carry the message into our communities about what we're doing and what they're doing. And more recently, we're seeing the shift. The foundation wants to know what you think. What do you see as the pressing community issues? Can we carry through FAN those messages to the foundation that also impact their work and their support of projects across the area? Next. Recommended changes. I'm not going to read all these, but you can see why we've done some of the things we've done, including the newsletter, including retreats or professional development, the plug and play activities. I think that speaks to what John has been doing with his little talks and his happy hours. Sharing the resources. Hopefully we'll have all that available that you can access on a website or access through each other. Human resources are probably the most important in the FAN. And I thank you to everyone who's made this organization possible, and I look forward to seeing what the future brings.
Thank you so much, Sharon. All right, well, I am jumping in here. We're doing pretty good on time, but I will ask that our subcommittee leads try to stick to about 5 minutes in your overview here. So First, I'm going to turn it over to Alice to talk a little bit about programming.
Okay. Thank you, Megan. So with programming, up until about a couple of years ago, programming committee was pretty strong across both regions, both Western and Central New York. And a couple of years ago was when the foundation kind of took a step back, wanted to reassess the FAN and where they were going. So this past year, the committee has really tried to kind of get up and going again. And what we started to do, like Sharon mentioned, were these happy hours and coffee hours to what I loved, Megan said, to help us all exercise our networking and getting together and collaboration muscle, to kind of remind ourselves that, you know, how important this is. And so those coffee hours and happy hours were not only fun, but very informative. And actually, that is how the Diversity, Equity, Inclusion, and Justice Committee got started through conversations. We would start out with full groups with these happy hours, and then we would break off into smaller groups, breakout groups. And in one of those breakout groups, this is where this idea came from. And it's exactly what Sharon was saying about how we're different as working as networks than the traditional way of making change with that top down, and now it's more bottom up, and it comes from that everyone's a leader. And I must say though to that, we're still getting used to that. I think we're not quite there yet where that comes easy for us, that, oh my goodness, there's not a chairperson and that is running things and is the key person, but no, we all need to take responsibility for that. And then another point through this programming was that Carrie Shallahorn from cohort 8 just stepped up and said, I have this this presentation, this workshop that I am working on and am able to do, and just offered to provide his leadership through the lens of the 12-step program. And so that's another way that is different when we work as a network, that if you have something, if you know of other network members that have presentations or workshops, you know, just contact us, contact Karen, contact myself, or anyone on the programming committee to say, would you be interested? We recently have had I think it's about 3 or 4 new members on the programming committee, and we just met the other week, or maybe it was this past week, to discuss where to go with programming. And I got to tell you, right now it's a little, we're working things out. It feels like we need to get something out there to our membership because it's been a while, other than the coffee hours and the happy hours. But what we're dealing with is that we have that great data from 2018, that survey, where people listed on their interest areas for programming. But with COVID and with what's going on with racial equity, that's kind of put in a new twist, so to speak, to what we are looking at with programming. So definitely the diversity committee, subcommittee, will be looking at bringing training and working with the program committee to do that. And then we will also be looking in regard to COVID, some ideas there that we would like to present coming up in the near future. That is, and again, we're always looking at things that are more specific to FAN and FAN members. than what people can get just, anywhere in regards to programming. So I think that's about where we are right now. Please, if you're interested in joining us on the program committee, let either Karen know or myself, and we will get you on that list for meetings. We are trying to come up, the steering committee meets every first Wednesday of every month at this time at 10 a.m. And so we're trying to do the same with our subcommittees so that there's a regular meeting that you can count on at least monthly. Sometimes the committees decide to meet a little bit more frequently depending on what's going on. And again, if there's questions about that, please put those in the chat box to me and I can address them.
Thanks, Alice. Appreciate it. All right, I am now going to turn it over to Max.
Okay, good. Can you hear me? Good. Okay, good. Yeah, Max Donatelli, and yeah, this committee, as Alice mentioned, came out of one of the coffee hours, and it was actually propelled by one of the members that was talking in our coffee hour, Brittany Perez, where she really felt that there really needed to be more done in the area of diversity, equity, inclusion, and justice. And so based on the discussion, the dialogue, we talked during that period of time that, we really, everybody that was a part of that group at that time thought that this was something that really needed to take some extra attention. So what we decided to do is to get together. There's a group of us, Pam Keffy, who's on right now, Brittany, who I mentioned, Denise Wilson, Alice Suffolk has been a part of it as well. Karen Hall has attended our meetings as well. And we recently joined Michelle Latham and Jeffrey King. And also Gary Damon has been a part of some of our earlier meetings as well. So I'm gonna, just read the first one here, the purpose statement, and we can share these, for people that might want to learn more about what we're doing, in the interest of time. But basically what we came up with, and this is our purpose statement, diversity, equity, inclusion, and justice exist to become a major influencer in the issues of justice, equity, diversity, inclusion in the network in Western and Central New York in order to advocate for continuous improvement in health and healthcare. So basically what we're trying to do, and we're working on basically a mission statement right now, but I think one of the things that we're really looking at is really trying to open this up more so that we really get more voices. And so we are talking about attracting it looks like we have some amount of funding from the Health Foundation, thankfully, to be able to do a development of a scope of work about what we'd really like to see, which is going to be part of what our next meetings are going to be, and then really look at hiring somebody to help to guide the process. And we are right now, as has been mentioned, we're really kind of all co-leaders in a lot of ways. I'm just kind of taking the since I was the one that was identified to lead this for the coffee hour at that time, and I've continued to see this as something extremely important. I have a son with developmental disabilities, and many times those individuals do get left out, and so certainly inclusion is something that's a big driving force for myself and the advocacy I've been doing. So next slide, Megan, please. We're looking at really right now, and again, these are things that we've talked about at our meetings. We're looking to establish priorities that can have the greatest impact. We're looking at identifying bridges and barriers that currently exist, as well as our committee will offer forums and conversations on race and diversity and the need for systemic changes, and working together with other organizations such as Leadership Buffalo, who's doing some things in this area, and others within our community, Voice Buffalo, which I was on a call with them last night. The committee will challenge the status quo, and I offer ideas for making our network stronger and more effective, people-centered and diverse. Okay, next one. And then these are just some things that we talked about actually some of our initial meetings, and Dr. Damon was involved in that, and this goes back all the way to June. But we're looking at potentially looking at surveying non-for-profit boards in the area of diversity, equity, inclusion, doing active recruitment of talented middle managers, and working in conjunction with the Health Foundation to help look at that and really excite people that are in those levels, develop a value proposition, and act to put together a toolbox that can be shared with organizations, offering workshops and so on, and identifying community needs and healthcare and gaps. So we're really trying to have an impact and really trying to do some things that can really help to move us further in this direction. So others that may be interested in looking at joining us, we certainly are open to hearing new ideas and really trying to make this have some greater impact, not only within the FAN internally, but also externally, and really trying to have a greater impact in Western and Central New York. So, and again, thank you, Megan, for also for putting together this orientation package, and I'm really pleased to be a part of it. So thank you.
Thanks, Max. Thanks so much. All right, great. I am going to hand it off now to Tara, who's going to walk through the work of the Communications Subcommittee.
Hi, everyone. So you can see on the slide what the Communications Committee is responsible for. The main pieces that we are currently working on are really setting up the social networking accounts. From meeting with current Communications Committee members, the Communications Committee hasn't really met and created or continued some communication work past the weekly newsletter. So one of the first things that we did when PHC came on board was really taking the place of Ruth Kamen, who did a phenomenal job with the weekly newsletter. And so we came on board and really started to just do some quick updates to maybe some of the work that we've put into the newsletter, as well as making some of the content more searchable and more cohesive in the design of the newsletter. The second piece is that the FAN Facebook page really was not updated or utilized in many years. And so the second piece that we really started working on was updating the Facebook page, adding some new images and posting to it daily. We've actually kind of taken the newsletter and the Facebook page and kind of integrated them. So some people that may not read the newsletter would be able to see some of the same content on the Facebook page, or if some information maybe wasn't newsletter worthy, or if the time of an event or an article was more time sensitive, then we've been posting on the Facebook page rather than adding it to the newsletter. Kelly Walters, she is on the call. She is part of the Communications Committee, as well as Bonnie Sloma. And we're slowly getting, under the work of what the Communications Committee will take on. So like I said, we're continuing with the weekly FAN newsletter. We are updating the Facebook page. And our next steps will include updating and then utilizing the LinkedIn page that was created for FAN. And then hopefully getting some more volunteers to be part of the Communications Committee, and then going on to creating a communications plan that the committee can kind of take on as their own. And once PHC has moved on, they'll be able to continue with the work that they've put together in the plan. Hold on 1 second. So that's, so this is the second slide. So that's really where the Communication Committee is right now. We do have, like I said, it's just myself, Kelly Walters, and Bonnie Sloma. We're hoping to get more volunteers as some of the work develops. But one of the largest things that came out was this Higher Logic platform. The community.fan.org, that will be how you can find it. That will be the URL that you would go to. It is not currently live, but that is what it will be called. This Higher Logic, as you can see, it's a community engagement platform. And it really is this wonderful tool that allows all members to communicate and connect with each other. But the other piece that's really cool is the more involved you are with the site, the more your profile, your bio, your communities and your connection grows. So the more interested and more you use the site, the bigger your connections and your community becomes. And so what can you do with the platform is members can have easy, now this is the thing, a lot of sites do this. You can find best practices, you can connect with other people, there's resources, events, and networking. A lot of sites are able to do that. But what happens with a lot of different sites is that those are kind of piecemealed in the back end. What this site is, that is what the site actually encapsulates, is that everything that is what the platform actually is. So there aren't any add-ons. You are able to have all of those best practices, the connections, the resources, events, and networking all at your fingertips. The other really cool piece is that when you're looking at the peer-to-peer connections, you're able to see what other people are working on. And not necessarily have to dig through different items to find the information you're looking for. The community members, the interactive community is a very cool piece, because what we can do is, if we look at the different programming committees or the like programming or the steering team, each of them can have their own community, their own place where you can have your members interact. You can have all of your resources. So your charters or your information, your meeting minutes. If Karen wanted to share a resource with the group in the steering committee, she'd be able to upload that and send out a quick note, and you wouldn't have to log into the site to receive that information. You would receive an email saying, you know, whatever Karen had posted in there. Here is our charter, take a look at it, let me know your thoughts. You would automatically receive an email with that information in there. So it's a really hands-on engagement platform. Can you go to the next slide? So if you look on the right, this is what the homepage will look like for the site. At the top, you can see where it has communities, directory, and participate. Those will be the three main pieces on the site that I think everyone will be very interested in. Like I said, the communities will be a drop-down menu where the more communities that are created, and the steering team will have input into the initial communities that are created, but obviously we will want the steering team and the program and the other subcommittees as communities initially. And you'll be able to drop down to those. The directory will give you a snapshot of all fan members, or you can search for individuals. And then participate will give you the opportunity to input library entries or post a discussion. And those pieces can either be separated by communities or to all fellows. So you have the opportunity to pick and choose who you would want to communicate with. So that is what the initial look of the site will be. The back is very white, but I still am playing around with some of the design of it. But we do have the site up and at least working on the back end. So the timeline, if you can see on the left, right now we're working on updating some information in the themes. And then what we'll be doing is working to upload all of the fan information. So it'll be name and their email addresses. And then any resources that are on the current fan site will be transferring over to the current site. So we'll need some help from the steering team and any other volunteers that are willing to work to, I guess, categorize and tag some of those resources. And so that they can be put onto the site in the right way, or in a way that people can search for those resources. So for the week of the 12th, we are hoping that the fan steering team, and again, if any volunteers on this call would be interested in helping with maybe the back end or any information in regards to this platform, feel free to reach out. So the week of the 12th, like I said, we'll have the steering team test out the site and work out any initial kinks. The week of the 19th, we hope to go live, and that means that all fan members will have access to it. There'll be some back end work and an informational email that will go out. And the week before, I'm hoping it'll be in the newsletter so we can give them some pre-information prior to the lot going live and then the fan email going out. And then we will have, like I said, information and news in the newsletter. And then I will be scheduling an information webinar for sometime in early November. So once everybody can get in, I'm hoping to have a live webinar to go through the ins and outs with all fan members so that we can answer any questions or if there's any concerns or, you know, it's just an opportunity for a Q&A and to walk through the site. So that's where we are right now with this site. I'm very excited about it. I think that it's going to be wonderful. I think it's a wonderful engagement tool. And I know some of you have already, we've already discussed this, but and I will stay on till right at 2:30. So if there's any questions, again, you can put them in the chat box.
Thanks, Tara. All right, I'm gonna hand it back off to Karen again to close this out.
Okay, so I was just looking up the calendar invite that I have for the next steering committee meeting, making sure that everybody's email is updated in there. And I did miss a couple, so I just added you in. So please check your inbox and let me know if you did not get a calendar invite for the fan steering committee meetings that are going to be monthly for the remainder of the year. If you are not on the steering committee, and I know that there's folks on this call right now who are just part of some of the subcommittees and not steering committees, don't worry about that. But please check your inbox for that invite from me. If you didn't get an invite, let me know right away so I can get you on the list. And so you can get that on your schedule. For the different programs, your committee leads will be reaching out to you for that, for any of the upcoming meetings that are scheduled. Trying to think what else I need to say here. If you have ideas for anything, then please bring them forward. This is a very open group and we're open to anything. So we'd love to hear your thoughts and ideas. And I believe that that's it for me.
Ooh, it feels good to stop that share. I don't know about you, but it feels like you wake, like it's so nice to see faces again. Everyone's still here. Hello again. Well, we have a few minutes for question and answer before we wrap up today. Does anyone have anything that they want to share or any questions that you might have? Who knows? John, I think you had a question about furry animals.
I just had a suggestion because we saw a couple of kids and animals and heard a couple of animals come in and out. So now that it's done, this is the only good part about the Zoom stuff is you can judge people's houses and see their kids and pets. So if anybody has kids or pets walking around, I think it's fun to see them. So bring them on.
Here we go.
Oh wow, Karen.
Here's one. Am I muted? I'm not muted. This is Riot.
Riot, great.
One of, yeah, my white fur baby. Got a all black kitty, and then I have a white deaf dog who's at daycare today. So it's very quiet in the household today. Am I the only one? Anybody else? He was at my feet the whole time, so this was easy.
Our dog is outside, so you don't get to enjoy seeing Sadie. She's feeling the sunshine.
Want to say hi, everybody? Say hi. This is Joshua. Hi, Joshua.
He wants to see the kitty cat. That's how he's coming. That's all. Look, right here.
He's loving me right now.
Can you see Mama? Can you give Mama? Yeah. Yeah.
Well,
you want to say
you.
hi? Oh no, he's had enough. He's out of here.
Well, thank you all for carving out so much time for the conversation today. Next week, we will be we'll share a list. I know Pay had asked the question in the chat about what subcommittee am I signed up for? Some of you might have signed up for one, might not have, might want to change where you've landed, and that's fine. We'll get some clarity just so that we can make sure that no one slips through the cracks and that we make sure you're included in the invites for all those groups. So please reach out, ask your questions, and let us know how we can help acclimate you to this work. But most of all, welcome. Thank you for being a part of it. I'm excited to work with you.
And I would add, if you think you're confused about subcommittee or whatever committee you're on, you are not alone. So there's a few of us out there. Yeah. So I think from this, you know what committees there are. Steering committee is the big major committee. And then there are also the 3 major subcommittees at this time. So it's your choice for subcommittees. Yep.
TGIF, everybody. Great seeing everybody.
Bye. Have a great weekend, everyone.
Have a great
Thanks.
weekend.
Take care.
Bye,
All.
thank you.
Bye.
Bye.
Bye.